Hi, Balance Massage Therapy community. Today is Monday, January 10th. We have decided to close for another week and reassess again on Friday. We emailed the team this weekend with our reasons, so I'm going to be sharing those reasons in the email below. I want to talk about them quickly, and I want to share how you can help the team during this time if you're so inclined. We have had quite a few people reach out to me about that, so we wanted to get that information out to everyone. First of all, the reasons for the closures remain the same. We still have 4 teammates inside of COVID protocols, with 1 entering it today as a new entry. We have very strict COVID protocols in place, and so we want to make sure that the team has a chance to move through those and they and their family are healthy. We also have a lot of clients that have been inside of it. As you may know, the numbers in Washtenaw County are at the highest they've been during the pandemic. The odds, if you're listening to this, is you know someone currently who has COVID or who has been exposed to it. Just due to that community spread, we're taking the extra step to remain cautious and closed. We still have a lot of clients who have reached out to us to change appointments or cancel appointments, so we're being mindful of that. The third reason is we just want to be good community members. We're in the healthcare industry. Our whole point is to help you and your wellness plans, and we feel we need to be very mindful of that during a pandemic. We wrote last week how our goal has been to do no harm and to make sure that we are not a place that is helping with community spread. So we're going to pause and reassess all of our COVID protocols this week and re-roll them out for when we do reopen, so that we can make sure we are 100% clear with the community on what the needs are to come in, and that the team also has a chance to review them as well and give any feedback. We appreciate the healthcare workers who are out there in the middle of this, and we also want to do our part to support them. Hospitals continue to be overrun. We do feel with more time, 2 things will happen. The numbers hopefully will start to come down, but also medicine is going to help be able to get us out of the thick of this number. So everything's a waiting game as always. Time is going to help. I'm confident we can reopen even with the Omicron numbers higher than we'd like, or we can't control that. But what we can control are the safety measures inside of these doors. The team feels safe for the most part working as long as we can do what we can do to keep them safe. So we might be returning to temperature checks just to be extra safe. And we're going to be very clear in both booking and confirmation calls on what the expectations are from the community before you come in. So we promise that we're doing everything we can. Our goal is to get reopened as soon as we can in the safest way. That's always the goal, to stay open, but to do so in the safest way possible. So that's where we're at. If you want more information on that, again, I'm just going to be sharing the information we shared with the team so that you can see those decision-making factors. We have a team that is front desk that are employees, and we have the therapists who are independent contractors. The front desk team, we're trying to use them as much as we can, which isn't a lot. So we actually have suggested that they go on unemployment during the closure. For the therapists, they don't get unemployment. They are contract workers, and that ended. They did get it throughout the early parts of the pandemic, but that has since ended. So one of the hardest decision-making variables when we do this is knowing that we're impacting the financial health and security of the team. So I said to the team, there's 3 things that we weigh when we look at health. There's health, physical health, mental health, and financial health. Chris and I have looked at all 3 of those several times during the course of this pandemic. The closure makes us healthier, right? Keeps us safer. Mentally, there's not the stress of having to just work inside of COVID protocols and do contact tracing plans all day long, which is a lot of stress for the front desk team and for the stress of balance as well. Financially, it's harder. It is a hard decision to close a business for any time, let alone for 2 weeks, coming right out of Christmas as well. So, in the early stage of the pandemic, we had a BMT client, an angel client, donate $5,000 to Balance. And I can rarely talk about this without crying, so forgive me. And during that time, we just had no idea what was going on. And that gift propelled us to keep us working, and it helped us keep the doors open, and it was a game changer for us. When Chris and I got this new location and knew eventually our finances would catch back up, we reached out and asked if we could start to repay it. They let us know that their whole reason was to make sure balance was okay, so to not worry about it or to not repay it until we were 100% okay. So we were like, well, at least let us repay half of it. And we hadn't started, but our plan is to get a year under this belt here and then to make some monthly payments to pay them back, because we appreciate it, but we want to be a place that pays things forward. And I feel it was the right thing. So what Chris and I talked about this weekend is to take the other half of that $2,500, and to put it in a fund for the therapist so that we can see who needs help and find ways to get them help during this closure. So what we're asking is, if you want to help contribute to that fund, feel free to. What we're doing is we're asking the team to let us know if they want to be a part of it and how we can make sure we're getting it to them. This week, we're going to start this week. This would be their normal payday. So I'm going to send an email out, a link in this email that shares how you can contribute to that fund. If you want it spread among the team, or if you want to donate directly to a therapist, you can do that as well. But we wanted to let you know what we're doing to try to help ease any pain financially that the team is feeling. So that's where we're at. We know not all of you are able, and that you've given in the past, so please do not feel obligated to give us 1 cent. We will get through this. We just have had enough people ask us in the past week how they could help, and we thought this was how we could help, and we just wanted to share it with you. So again, just listening to this is support. A lot of you have called and shared warm sentiments. I've gotten a lot of emails from you that share things that inspire us and keep us going. So thank you from the bottom of my heart. We appreciate just your kindness. It means more than anything to us right now. So that's my story for today. We will reassess things on Friday and update everything. And we hope you're staying safe and you're staying well, and that we get to see you soon. Bye.